So our normal cardiac output is 4 to 8 liters per minute in an adult. So that's something to know when we're taking care of these patients, what our normal is. Now, the only thing is that similarly to a ventilator, or ventilated patients, where we want to ensure that the volume of air that we're giving in their lungs is really based on their ideal body weight, and not necessarily their current body weight, because even if you're overweight, it does not mean that your lungs are bigger than they would be if you were not overweight. So we want to also measure the cardiac output based on a person's size, essentially. So we will measure the cardiac index. It's actually divided by the body surface area. So it's a cardiac output divided by body surface area. So our units that we're going to use for that is liters per minute per square meter. So our normal for cardiac index is 2.5 to 4 liters per minute per square meter. Now, oftentimes in critical care settings, we will target maybe a minimum 2.2 cardiac index for our patients. And when it's below that, then we will start doing some interventions to try to improve the cardiac output. So I'll just show you quickly how we would actually do a measure cardiac output through this thermodilution process. So as you remember, we have a line here that's getting all my NS from that bag to fill in my syringe. Here is my central venous pressure that I actually close to my central venous pressure so that whatever fluid I push through my syringe goes directly into my catheter, and into this yellow piece, okay? So first thing to do is actually to bring fluid in. Once you have the fluid inside of your syringe, you're going to be ready to actually push that out. There's a few steps though before you push on this. One of them is actually pressing on the thermodilution cardiac output window. And so you're going to have a little window like this that comes up for cardiac output. What you're going to see on this is actually a waveform. So as you press on your fluid, you're going to see a waveform show up. And that's just showing kind of the movement of the fluid and also the change in temperature that we're going to see. When we're pushing, so when I mean pushing, I mean just a brisk, stable push. That's still fairly quick. You don't want to take your time. You want to push hard and fast, but steady. You want to be doing that at the end of expiration. The reason for that is that at the end of expiration, there are no intrapulmonary forces that are preventing blood from moving forward. So when we take a big deep breath, we can decrease our venous return. So we don't want to be doing that. So that's why we really want to be taking this measure at the end of expiration. So as the patient's about to breathe out, at that end of their exhalation, that's when we're going to push. So now I'm looking at my patient. I'm looking at his breathing. I see he's breathing in. I've pressed on my start button that tells me please inject now. So I'm ready. So I'm looking at his breathing. Breathing in, now breathing out. So I push fast the fluid out of my syringe. So that will give me a waveform on the monitor and will give me a number that will show up once an algorithm calculates the cardiac output. So after measuring our cardiac output, you can see that we got a cardiac output of 5.62 liters per minute. So from here, we would be doing multiple measurements to try and get an average. So we could do 2 to 3 measurements because there may have been other forces that could have affected the measurement itself. So either that we would have pushed too slowly, or we weren't steady, or maybe the patient took a breath sooner than we thought, so it interrupted our exhalation. So we do want to take 2 or 3 measurements and take an average. And once we have this number, we could normally in other monitors, not this one unfortunately, but in other monitors, we can go and calculate the cardiac index. Since on admission, we always enter the height and weight of our patients. So we'd be able to calculate the cardiac index since it's cardiac output divided by the body surface area. the monitor and computer itself would actually make that measurement and give us the index that we would work with.